Thank you for the very kind presentation. And indeed, it's a great honor to be part of this international conference on inclusive early childhood education and to have the opportunity to interact with the wonderful audience and especially to make the presentation just after Madame Gayatri, who's really impacted on us with her lovely evidence-based presentation. I'm here with a colleague, Persis. She's helping me to run the slides for me, and I'll ask her to immediately share the slides and we'll get going. Otherwise, a good afternoon from Kampala, where it's about 5 p.m. here. Thank you very much. And our topic is how can inclusive teacher training approaches enhance the learning outcomes for younger learners with disabilities. And of course, your presenter is Joseph Walugembe. It's a very long name. Even Ugandans struggle to pronounce it properly. So feel at home. Next. I'll briefly talk about the STROMME Foundation. We are a Norwegian international development agency with a program in Asia, West Africa, and East Africa. In East Africa, we work in Uganda, Tanzania, Kenya, and South Sudan. Promoting quality inclusive education for all learners is one of the major strategic program intervention for STROMME Foundation. And our current strategy, which ran for 5 years since 2018, specifically focuses on quality inclusive early childhood education, which in Uganda and actually most East African countries applies to children from the ages of 2 to 8, and that's children within the pre-primary learning arrangement, and also children in lower primary, which is from primary 1 to primary 3. We have 7 years of primary school in Uganda. STROMME Foundation targets, or our interventions are mostly in low-income countries and countries, fragile states experiencing humanitarian emergencies. And maybe that's why it explains that most of our programs in East Africa are within the refugee camps in northwestern Uganda, and in Asia, Myanmar is a country of great interest. The results they released for 2020 for primary education indicated that no deaf learner passed in the first grade. But most unfortunately is that 80% of the learners who are deaf who sat primary living examinations were ungraded. Ungraded in Uganda means that they didn't get anything. They did not earn any score worth grading in those particular examinations. We all know the limitations of final examinations as a means of assessing learning outcomes. But despite those limitations, which could be a subject for another discussion, we can still hold that those results from the 2020 primary living examinations for deaf learners, if they were the measure that was applied to the whole country, that they clearly speak of very poor or very sad, very unacceptable learning outcomes for learners who are deaf. Other learners with disabilities probably had better results than those, but they did not necessarily compare with the learners who do not have disabilities. As an education and development practitioner, I must hasten to mention that this does not mean that learners with disabilities are certainly academically less capable than their counterparts without learning disabilities. But rather for me, it's an invitation to re-examine how teachers are in the first instance trained, and how are they continuously professionally developed, and therefore how do they teach learners with disabilities. In my subsequent slides, I'll speak very briefly to the experience, to what STROMME Foundation is doing to promote, to improve or to develop the teaching practices for teachers with the view to improve learning outcomes for learners with disabilities. The first I want to speak to is continuous professional development for teachers. And I want to emphasize the importance of continuous professional development on inclusive pedagogy for teachers in a country like Uganda or East Africa, because majority teacher training colleges do not cover inclusive education in their curriculum. And if they do, it is usually 1 or 2 short modules, which definitely does not adequately prepare teachers to effectively support the diverse needs of learners with disabilities in the learning settings that they manage. So that makes in-service training for teachers very critical in developing the competences for teachers to be able to work with learners with disabilities in their classrooms and all the teaching experiences that they have. But the point I want to emphasize here is that more often than not, most non-state actors that support teacher training on inclusive education do it through one of maybe 2 to 3 days or 5 days training workshops. And here I'm saying that approach is not effective for improving the competences of the teachers to be able to translate whatever they do into learning outcomes, better learning outcomes for learners with disabilities. What are we experimenting at STROMME Foundation? At STROMME Foundation, we are working with other organizations in what we call the Together for Inclusion Consortium, and I'll be referring to it severally. In this consortium, we have a model with about 10 or 12 modules, which instead of being covered in 2 to 3 days, we sequence them over a 2 to 3 year period, during which we cover a range of topics, beginning with the basics of what inclusive education is, the role of special needs education within inclusive education, identification, etc., etc. And the idea is that through this model, teachers can have a training program that includes workshops, trial out periods, feedback period, and experience sharing periods. Another point that I would want to emphasize in this module is the bitter reality that cascading models don't seem to work. Of course, given the constraint of resources and time, the tendency is to have 1 or 2 teachers trained with the hope that such a teacher will go back and cascade or roll out the skills within his school or his district. But I think experience has taught us that is a very high expectation. And what we are doing in the Together for Inclusion Consortium is that we are making the training available and accessible for all the teachers in the respective schools we are working with. I'll move on. And here I'll talk about the importance of standardization of teacher training programs on inclusive education. We cannot thank especially non-state actors for the effort they have invested in promoting teacher training on inclusive education, because here where I sit in East Africa, this is mostly done by non-state actors, international NGOs, organizations of people with disabilities, national non-government organization, faith-based organization, mention all of them. But increasingly, we've also realized that the lack of a common approach by these agencies supporting and promoting inclusive education is contributing to the lack of clarity on what should be meant by inclusive education, but most importantly, how it should be delivered to teachers, for teachers to be able to translate it into better teaching and learning processes to improve the learning outcomes for learners with disabilities. Some organizations will do a 2-day training, others will do an annual training, others will focus on, will not draw the link between inclusion and special needs. Others will emphasize one aspect over the other, and the diversity can go on and go on and go on. Without necessarily being a critic this evening, it cannot be understated how urgently a national standard of some sort, or at least a common approach, how important it is if we are going to be able to monitor how the teachers are being trained and to subsequently monitor how they are delivering what they have learned to improve learning outcomes. If I could draw from the experience in Uganda, the actors in the Together for Inclusion program, and we are several organizations, we are working with other stakeholders delivering inclusive education under the coordination of the Ministry of Education to develop a comprehensive professional development module for teachers on inclusive education, which will have both theoretical and practical modules with a view to enhance, to give them the opportunity to continuously refresh their inclusion skills. We hope that when that training program, that module on continuous professional development is developed, it will be usable across by all organizations that want to promote inclusive education or teacher training on inclusive education. And that will create some kind of a common denominator in terms of what skills all the teachers are getting. It will also probably allow for harmonious monitoring of what is working and what is not working out of that, that training. We will move on. We want to reflect also briefly on the value of supporting teachers to collaborate with other stakeholders to improve learning outcomes for learners with disabilities. I think there is a paradox here that no one disputes the centrality, the importance for teachers to collaborate with a wide range of stakeholders within the community, within the environment of the learner and the parents. And this couldn't be more urgent for learners with disabilities or special needs. Yet the contradiction is that this just doesn't happen. The education system in at least most East African countries which I'm familiar with does not have systems and mechanisms for facilitating effective collaboration between teachers and other stakeholders like parents. Systemic problems like the high teacher-pupil ratio and the challenge such a burden presents to the teacher even denies the teacher any other time outside their classroom, outside the weight of running lessons to engage with the parents. But parents are also busy struggling to survive the economic hardships that they are going through for majority of them. They also don't have enough time to engage with the teachers. If I could speak to the current pandemic, one challenge that the parents have is that they have lost, it's not so much how much learning the children have missed, but the kind of childcare that the school provides to allow the parents to move on and engage in other economic activities. But that's the link between the teacher and the parent and other stakeholders in a way negatively impacts on what would be the outcomes, the learning outcomes for the learner with disabilities. So in the Together for Inclusion, inclusive teacher training module that we are using, we have a couple of modules that are aimed at energizing the collaboration between teachers and other stakeholders. And we deliberately support the teachers to make regular home visits to the families of learners in order to deepen that collaboration. Let's briefly reflect on the capacitating teachers to appropriately use technologies and other learning aids to enhance outcomes for learners with disabilities. I think the COVID-19 pandemic has particularly elevated the role of technology in the continuation of learning, especially when teachers and their learners have not been able to interact within the confines of the classrooms, which we previously thought were the confines of learning. But nonetheless, the pandemic has also shown how the very technology can deepen exclusion of learners with disabilities, especially when it's not appropriately designed with the necessary reasonable accommodations for the different needs of the learners with disabilities. Here we talk about how radio programs excluded learners with disabilities, with hearing impairments. But we also talk of how the illustrations on television excluded learners with visual impairment. Leave alone the fact that many children with disabilities, for the variety of reasons that we all know, would usually be in poor households where access to these devices is a challenge. At STROMME Foundation, our approach here was to distribute and train teachers on the use of various technologies. We had, for example, solar radios with preloaded lessons, which teachers would take around in what became community learning centers when children could not come to school. 1 or 2 or 3 or a maximum of 5 children would gather at one of the homes. So the teacher would go over with this radio, with the pre-loaded lessons, and that in a way could enhance the involvement of some of the children, including those, say, with visual impairments. In the same respect, computer tablets were equally distributed, and these were particularly better suited for learners with hearing impairment and those others with learning impairments who need augmented learning, auxiliary communication modes. I'm about to come to a conclusion, but before I do that, I must emphasize that all these that I'm mentioning are pilots. And for them to, for all these strategies, approaches to impact on a reasonable number of teachers, to be able to impact on the learning experiences and outcomes of a significant number of learners with disabilities, requires sufficient scale up. And to get that scale up takes us back to the realm of policy. The appropriate policies that facilitate adequate budgeting are supposed to be in place. Which brings me to my concluding slide, which simply reiterates the points I've just made, that if we are to improve learning outcomes for learners with disability, part, and I must emphasize, part of the solution is improving how teachers are prepared, how teachers are trained and continuously developed to perform, to manage, to facilitate the teaching and learning experiences. I should have mentioned that teacher training programs, pre-service training programs for teachers should have deeper coverage on inclusive education than they seem to be doing at the moment. Programs for continuous professional development for teachers should be more harmonized, should have a national standard, and should have sufficient depth and breadth to be able to impact reasonable knowledge and skills about inclusion to the teachers so that they might have enough of it to deliver effectively to the learners with disabilities. Teachers should be supported to effectively collaborate with other stakeholders. And of course, they need to have the tools, the means, the mediums in form of appropriate technologies that they can use to improve the quality of their teaching experience, which may in turn result into better learning outcomes for learners with disabilities. Colleagues, this is what I have to present to us. Thanks for your audience, and I may now entertain and receive your enrichment of this rather short presentation. Thank you very much.
With constraints for teachers and parents, you outlined how does the program support teachers with an expectation of facilitating family visits on top of the overload of responsibilities. Wow, that's a brilliant one there.
That is a $1 million question. That's a master question. But I think we need to go back to the realities. Ordinarily, the government expects the teacher to come to the classroom to teach. So the teacher is remunerated and facilitated by the government to show up to his or her school Monday to Friday. If the teacher is two things then facilitate the possibility for the teacher to reach out to make these collaborations with stakeholders. First is that in most cases, especially in the rural areas, learners tend to be within reasonable radius, reasonable moving distances from the school. And imperatively, it means that teachers have the ability to reach out to those families with minimal resource input. But it usually takes a lot of other forms of motivation, especially in terms of showing them, illustrating the value of making that particular visit to the learner with disabilities. And from experience, it's those teachers who see how the home visits, how the collaboration with the parents enrich the outcomes of their learners who keep doing it. But in other instances where, for example, the distances have been larger, have been significant, an arrangement has been to provide, say, the teachers with transport, maybe with a bicycle, and say, okay, you may ride to this teacher, or you may take a boda, that's a motorcycle transport, to see the learners, to make these home visits. But what we don't do, and I would say you don't have to do, that I would discourage anybody from doing, is to pay an over and above allowance for just doing that, because then that would be probably counterproductive. Thank you. I'm not sure my answer is sufficiently adequate, but that's what we are trying to model around this innovation.
Next question is, what inclusive role do educational experts have to play to scale down early childhood curriculum to prepare school dropouts for mainstream public education?
School dropouts for mainstream education. That question is particularly handy now that we are discussing support of return to school in East Africa or in Uganda, where we expect schools to reopen in January 2022, having been closed for most of the time since March 2020. And the numerous challenges that have happened that may even deepen the exclusion of learners with disabilities and the girl child in particular from education. Currently, we are running campaigns with communities. In the schools we've worked with, we've formed structures that we call school inclusion teams as part of the Together for Inclusion program. And these teams are comprised of teachers and a diverse membership of the community, religious leaders, local leaders, business leaders. And these are drumming up door-to-door campaigns, really encouraging the parents to send back children to school when school reopens, of course, with a particular focus on learners with disabilities who are even most likely to be completely forgotten. But we are also, for example, in discussion with local governments to reactivate the teenage pregnancy reintegration guidelines that we have, because one of the challenges generally school is dealing with is girls who have unfortunately become pregnant during the lockdown. And of course, these include learners with disabilities. But also actually preparing the teacher. The teachers have also gone through a lot of trauma, a lot of stress related to the lockdown. So it's like they have also been, for the lack of a better word, it's like they have been dropouts from their profession as well. So we are working around strategies that target both the teacher and the learners to ensure a return to school for all learners with disabilities.
Mr. Joseph, I would like to ask this question. How do social intervention programs and policies help by providing access to finance at the micro levels to elevate poverty? I know Stroma Foundation is trying to tackle this issue of education and by tackling poverty as well at the lower level. So how do you combine this and how do you do this? So my question is, how do social intervention programs and policies help by providing access to finance at the micro levels to elevate poverty, which is also another cause of this uninclusiveness of people living with disability in terms of teacher training?
Thank you very much for that question, which brings me to speak about another part of STROMME Foundation's work. Along with supporting education, economic empowerment, livelihood support is a major intervention area for STROMME Foundation. In this particular case, I'll briefly speak about community managed saving programs. For all the schools where we collaborate, we also encourage the parents to form and join communities managed saving groups, through which they pool their own meager resources, lend them to themselves on concessionary terms, and the individuals then invest those monies and increasingly are able to improve their economic status. But also within the community managed saving groups, we have an additional portfolio, which we call the education fund. We also encourage the parents to put aside some very little money on their account, if I could call it that, which is kind of an emergency fund that they can have to resort to support the education of their children. Like, for example, one of the biggest challenges is registration for final examinations. It's usually a large amount of money which is required within a very finite time frame. And oftentimes, parents take advantage of the education fund within the community managed saving groups and begin to save towards the final registration of their children. But also quite often is that the investments they make from the pool, the loan they get from their pool, then help them to invest and probably get a bit of an economic base from which they can contribute to the costs of education, because even if education in Uganda is supportedly free, it's not necessarily free of cost. There are some costs that parents have to incur. And very briefly, I would say we have other interventions, social interventions that we move around the hardcore education programming that we do. For example, we pay a lot of emphasis on gender-based education, where we try to work with the teachers to make sure that schools are safe for both boys and girls. For example, issue of menstrual hygiene management is core to our education support. And also training learners to in some basic vocational skills that they can use to alongside with the knowledge they are getting in classroom. Thank you very much.